Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that shows up on almost every mammogram report but confuses a lot of people: breast density categories A through D. If you've ever gotten a mammogram result and seen a letter next to the word density and wondered what it means, this one's for you. First, what is breast density? It's not about size or firmness, and you can't feel it. Breast tissue is made up of a mix of fatty tissue and fibroglandular tissue, which includes the milk glands and supportive fibrous tissue. On a mammogram, fatty tissue looks dark, while fibroglandular tissue looks white. Density simply describes how much of the breast is made up of that whiter glandular tissue compared to fat. Radiologists use a standard scale with 4 categories, labeled A through D. Category A means the breasts are almost entirely fatty. Category B means there are scattered areas of fibroglandular tissue, but the breast is still mostly fatty. Category C means the breast tissue is heterogeneously dense, meaning there's a good amount of dense tissue that could potentially hide a small mass. Category D means the breast is extremely dense, with a lot of glandular tissue throughout. Roughly 4 out of 10 women fall into category C or D, so being told you have dense breasts is very common, not unusual or alarming on its own. Why does this matter? 2 reasons. First, dense tissue shows up white on a mammogram, and so can early cancers, since they also appear white. This means dense tissue can make it a little harder for the radiologist to spot something that's there, similar to trying to find a snowball in a snowstorm versus finding it on a clear field. Second, having dense breasts is associated with a modestly higher chance of developing breast cancer over time, separate from the issue of visibility on imaging. It's important to understand these are 2 different things. One is about how well we can see on the mammogram, and the other is about underlying risk. It's also worth knowing that breast density is a very normal, common trait, not a disease or an abnormal finding. It's influenced by things like age, genetics, hormone levels, and whether someone has been pregnant or is breastfeeding. Density tends to decrease naturally as women get older, especially after menopause, though this isn't true for everyone. Because of these factors, many places now require that mammogram reports tell patients their density category directly so they can have an informed conversation with their doctor. If you're in category C or D, your doctor might discuss whether additional imaging, such as breast ultrasound or breast MRI, could be helpful alongside your regular mammogram. This isn't a one-size-fits-all decision. It depends on your personal risk factors, family history, and overall health picture, which is why this conversation should happen with your own doctor rather than through a general rule. Here's the practical takeaway. When you get your mammogram results, look for your density category, and don't be alarmed if it's C or D, since that's a very common result. Instead, use it as useful information. Bring it up with your doctor and ask what it means for your personal screening plan going forward. Having dense breasts doesn't mean something is wrong. It simply means your doctor may want to tailor your screening approach a bit more closely to you. Understanding your density category is really about being an informed partner in your own care, not something to worry over. As always, if you have questions about your own mammogram results or your personal risk, please talk with your doctor, who can look at your full history and guide you properly. Thanks for watching, and take good care of yourself.